Parents were notified yesterday that a Clemson Elementary School student had been diagnosed with whooping cough and that their children may have been exposed.
News 13's Evan Donovan joins us from the Greenville News Center. And Evan, the diagnosis follows a recent trend of higher outbreaks of diseases that should be controlled by immunizations.
That's right, Tammy, and due to health privacy laws, there's no way for us to know whether this child had been vaccinated against pertussis, or whooping cough as it's better known. But what we do know is that more and more parents are refusing to vaccinate or delaying vaccinations for their children, which is putting all children in more danger. Yesterday, parents of Clemson Elementary students were told their kids had been exposed to whooping cough during the first 10 days of the new school year. Do we know if this child had been immunized against pertussis?
Because of healthcare privacy laws, I can't discuss it.
And though most parents do it and it's the law,
over 99% of our students are immunized.
There are still exceptions.
At this point, I've taken the exemption because I don't believe in it.
Heidi Henry is a former nurse and parent of a middle schooler. She's getting an exemption from the new 7th grade booster requirement that protects against tetanus, diphtheria, and pertussis.
I know some personal situations and also some research that autism. I also have a friend whose child directly related to a vaccination was not able to walk about a week after, and he's been disabled since that point.
But doctors and health officials say those links are unfounded.
It's somewhat refuted by anyone that has done any good science on it. And there have been multiple studies since then looking at populations of unvaccinated versus vaccinated children, and there is no difference in the rates of autism.
The original studies that prove that link have been all withdrawn, and anybody else who's tried to repeat those studies hasn't not been able to replicate those findings.
The data show that parents' fears are having a dangerous impact on all children. The number of cases of whooping cough are up over 500% in the last 20 years to rates not seen since the early 50s.
Well, the danger in that is, the more children you have who are not immune to the disease, the more easily these disease spreads.
And doctors and epidemiologists that I spoke to today said these fears about vaccinations come from a good place. Parents don't want to harm their children, but nevertheless, they said the science does not back up these fears, pointing out that mental illness and sometimes the onsets of autism come on around the same time that kids get vaccinated. To learn more about vaccinations for parents, go to WLOS.com and click on News link. I'm Evan Donovan reporting live from the Greenville News Center.